In so many ways, 2023 was the best year yet at Chesapeake Regional. Not only did we earn our first magnet designation, we did so with 2 exemplars for clinical quality. The exemplars highlight the outstanding care our nurses provide every day. The magnet appraisers were witness to all the ways that Chesapeake Nursing amplifies, verifies, and exemplifies the standards of the magnet organization. We are so proud to have earned this prestigious designation, and we did so because of the excellent work that you do at the bedside. Magnet challenges us to not only implement evidence-based practice, but to create it. Our designation reflects the exceptional nursing care that you provide daily. I'm so proud to witness our nurses day after day remaining steadfast to our oath of devoting ourselves to the welfare of those committed to our care. I am forever grateful for the privilege of being a Chesapeake nurse and serving as your Chief Nursing Officer.
So the question is, how have nurses made a difference in my life? And of course, I'm married to a nurse, so I can't help but not think about that when you pose that question. That's made a difference to me in every day of my life. So, but in terms of work and what did nurses mean to me at work? Of course, I work with a lot of great nurse leaders, and that's who I work with the most on a day-to-day basis. But I'm fully aware of what nurses do at the bedside, and also nurses in other roles too, support roles. So their level of acumen, their level of understanding of hospital operations, their ability to be empathetic with patients and families, it just all comes into play to make such a profound difference. And really our reputation in the community is largely dependent upon how people take care of everyone every day. In terms of special thanks and attaboys and attagirls, the success of achieving Magnet is remarkable. I've said on more than one occasion now publicly that in our organization's history it may be our singular greatest achievement. So thanks to everyone that was involved, nurses and non-nurses, but largely this really does fall upon a shared governance model and the leadership that goes into it, which includes staff participation and involvement. So thanks to everyone involved. Thank you very, very much for making history.
Happy Nurses Week 2024. It truly is a pleasure to be part of the nursing team here at Chesapeake Regional Healthcare and be your colleague. I'm so excited about where we've been over this past year with our Magnet journey, our accomplishments with our programs such as open heart, trauma, neuro, our advances within women's services, and all the wonderful things happening. I'm so excited about the year ahead of us. Please take time this year to reflect on your nursing practice and really take measure of all the things that you've contributed to our professional practice and how you've grown over this past year. Congratulations, happy Nurses Week.
Nurses hold a special place in my heart. I have a daughter who became an RN just before the beginning of the pandemic. And what you do every single day to support our patients and our community is so important. It takes a special person with a lot of patience and a big heart. Congratulations to Amber and all of the nurses here at Chesapeake Regional for achieving Magnet designation. The sky's the limit.
I want to take the opportunity to thank our nurses. Happy Nurses Week, and it's truly deserved. We can't do what we do without the nurses. The nurses are our first line. They are our eyes and ears when we can't be there. They're the first to assess the patients. We've made some significant strides, and one of our achievements was the Magnet designation. I want to thank Dr. Amber Edgett and her team for inspiring the nurses to achieve this goal, which was truly amazing. We can't do what we do without you. So I want to say thank you to all of our nurses. Happy Nurses Week.
Nurses have made a lot of difference in my life as a physician. In the beginning, collaborating with me, using their clinical knowledge and critical thinking skills to identify problems sooner so that patients receive the correct care most efficiently and quickly. And in later years, over the last 10 years, I've had the benefit of working with nurses partnering with me to change activities or processes or treatment plans in order to benefit many patients all at once. And so I've had the benefit of working with care managers, infection prevention nurses, quality and safety nurses, and nurses who work with me on teams in performance improvement activities that really help improve healthcare for everyone, not only in the facility, but oftentimes reaching into the community and the population at large with preventive health activities that keep people healthier and prevent disease and accidents and injury. It's such an honor and a privilege to be working with some of the very best nurses out there here at Chesapeake Regional, nurses who have achieved magnet status, and it's well deserved. Their attention to keeping up with the latest in healthcare, bringing innovative ideas to our community is much appreciated. I'm so proud to be working here among these great nurses.
Happy Nurses Week, everyone. It's my great honor to thank each of you in this special week, and more importantly, every day. Nurse is just another word to describe somebody who is strong enough to tolerate anything and soft enough to understand anyone. Save one life, you're a hero. Save 100 lives, you're a nurse. Thank you for all that you do. We thank you for providing an empathetic ear and compassionate hand when a life-changing diagnosis is delivered. You are the caregivers, communicators, decision makers, and patient advocates. Thank you for being excellent nurses. We appreciate you. Thank you from the bottom of our hearts.
Nurses make a tremendous difference for me. I couldn't do my job without the tremendous help of nurses throughout this organization. I'm blessed to work with a great team and a great team of nurses, from those that are in the ICU to those that are on the floor, those in the operating room, as well as those here in the clinic. I'd be remiss if I didn't give a special shout out and kudos to all those nurses that I work with, especially because my grandmother was a nurse, and so she taught me very well to always listen to my nurses. So with that, thank you for all that you do, because I wouldn't be able to do what it is that I do, and that is provide great and exceptional care to the patients that we serve. And that all starts with the nursing care that is really delivered by some truly phenomenal nurses led by a great team of nursing leadership and a great organization. So happy Nurses Week.
Happy Nurses Week. This year's the nurses theme is Nurses Make the Difference, and we have known that all these years. You guys not only make a difference in patients' life, but also in society in a positive way. In Latin, nurse means nutrix, which means to nurture, to care. And you guys are not just limited to taking care of the patients at the bedside, but you have been wearing many different hats in quality, infection control, nursing supervisor, and also in admin. Thank you for everything and every day that you do. You are the true picture of selfless souls. You are the true mate for the doctors. You are there to help us out, and I'm sure we could not have done it without you.
I leave you with a quote by an unknown author that so eloquently describes what it means to be a nurse. A nurse is the one who opens the eyes of a newborn and gently closes the eyes of a dying man. It is indeed the highest honor and blessing to be the first and last to witness the beginning and the end of life. Happy Nurses Week.